When you swallow a tablet, where does it go? How does it travel through your body? And more importantly, how does your body actually absorb it? In this video, I am going to explain the 7 main mechanisms by which drugs are absorbed across cells, from simple passive diffusion to endocytosis. We'll see in this video. So, the cell membrane acts like a selective gate. Okay, this is a cell and this is the membrane of the cell. It acts like a selective gate. To enter into the cell, the drugs can take any of these 7 routes. Okay, the first one is the passive diffusion. This is the main method. Most drugs use it. Around 90% of drugs are absorbed through passive diffusion. It works without any energy. Okay, here is a new word, that is driving force. Remember this. It means it allows the molecules, allowing the molecules to be transported from the higher concentration to the lower concentration. What is that? We'll discuss. First, in passive diffusion, the driving force is concentration gradient or electrochemical gradient. Remember this. Now coming back to the driving force. Driving force, if for example, if there is a drug in GI tract, okay, so here the drug is more. Okay, for example, if there is more drug in GI tract when compared to the blood, so it moves from the higher concentration to the lower concentration. So from the GI tract it goes into the blood, just like how the perfume spreads in a room. That's like the drug moves from the GI tract into the blood, from higher concentration to the lower concentration. No energy source is required, hence the process is called as passive diffusion. While passive diffusion, the drug is in aqueous solution, partition and dissolves in lipid material of membrane. Then it finally leaves it by dissolving again in an aqueous medium inside of membrane. It follows Fick's first law of diffusion. The simple funda is, here see, for example, the drug has the higher concentration here. Here is the lower concentration. So what will happen? As we saw, from higher concentration to the lower concentration, the drug will move. Okay. So here that only. Fick's law states that the drug molecules diffuse from a region of higher concentration to lower concentration until equilibrium is attained. Its formula is dq by dt equals to dak by h and multiplied by c git minus cp. So we'll see what these terms are. dq by dt means rate of drug diffusion, d equals to diffusion constant. Okay, a means surface area of absorbing membrane and k is partition coefficient. This is c is the concentration of GI and concentration of plasma. Then if we subtract them, we'll get concentration gradient. Lastly, we have membrane thickness. So bigger the surface area means faster absorption. Higher concentration in GI tract means faster movement. Thinner membrane means easier passage. It can cross easily. All this together decide the permeability coefficient or P. It is the final deciding factor. So under usual conditions, we are taking the D, A and K and membrane thickness will be the constant. So we are taking it as P. So our equation becomes dq by dt equals to pCE When you plot a graph, it will be like this. On the on the x-axis, you are taking concentration of drug at absorption site, and on the y-axis, rate of drug absorption you are taking. Then we have the pore transport. It is also called as filtration, convective transport, or bulk flow. It is important process for of absorption for low molecular or small sized or water soluble drugs like urea. If a drug molecular weight is less than 100 daltons, okay, then it can pass through pores easily. And here the driving force, okay, remember driving force is hydrostatic and osmotic pressure, just like a liquid. Okay, for example, it is a liquid is pushed through a sieve. This is sieve. Okay, this is sieve and this is liquid. Okay, so it is pushed through a sieve, just like that mechanism follows here. So chain like or linear compounds of molecular weight up to 400 daltons can be observed by filtration. Okay, then we have the facilitated diffusion. Okay, this one is carrier mediated but does not need required any energy because it follows downhill transport. Downhill means higher concentration to the lower concentration. It has a faster rate than simple passive diffusion but only works from higher to low concentration. Okay, for example, levodopa, glucose, vitamins we translocated by this process. Since it needs no energy, it is not affected by poisons like cyanide and carbon monoxide. So here our drug, it is here, it wants to cross the membrane. So what it will do, it moves from the higher concentration to low concentration, but it requires a carrier, so it binds to the carrier and moves to other side of the membrane. Then we have the active transport. This is the opposite of passive diffusion. Okay, here the drug moves from low to high concentration. It is an uphill transport system. Okay, and here it is an uphill transport system, means lower concentration region to higher concentration region our drugs move. Okay, so the process is uphill, so energy, okay, energy is required. Okay, so from active transport you can remember ATP is required. Okay, energy means active transport, ATP is required. Okay, as the process required energy, it can be inhibited by metabolic poisons like carbon monoxide and cyanide. Only translocation of vitamins, Na, K, etc. will be done here. So if our drug wants to cross this membrane, so it cannot cross because it is in active transport. It requires ATP. Okay, energy is required here. So after getting the energy, it will easily cross the membrane. Then coming to the ionic or electrochemical diffusion, here is the twist. Okay, the charge on the membrane, okay, charge on the membrane or charge on the drug will decide the drug entry. So unionized molecules drugs will be observed easily, but these anions and cations will behave differently. Okay, example, our drug, it is a cation. Okay, It wants to cross the membrane. It forms a neutral by forming with anion a complex. Okay, so it will be neutralized and it crosses the membrane easily. Then our drug is released. So it is in written form here. A cationic drug is repelled due to positive charge on the outside of the membrane. Once creating an electrical gradient, drugs can move downhill with electrical gradient known as electrochemical diffusion. Then we have the ion pair transport system. In this, the ionized form of drug molecule that cannot pass through lipid cell membrane form a reversible pair with the oppositely charged endogenous ions of the GIT. Okay. Some drugs are ionized and cannot cross the membrane on their own, so they form a temporary neutral pair with an opposite ion in the GI tract. This ion pair becomes lipid soluble and can sneak through the membrane easily. We are taking example of propranolol and oleic acid. They form a pair and sneak through the membrane easily and releases separates. Okay. Lastly, we have the endocytosis. This is a minor but fascinating mechanism. The cell membrane engulfs the drug, forms a vesicle, and pulls it out inside the cell. Okay, pulls it inside the cell. Our drug is outside the cell. The cell membrane engulfs it, and our drug is inside the cell. Now it releases, it pinched off our drug inside the cell, and only the translocation of fats, starch, vitamins will be seen here. It involves two types, phagocytosis and pinocytosis. Phagocytosis, cell eats solid particles. Pinocytosis, cell drinks fluid or solute. Okay, so next time you pop a pill, remember it might be gliding through pores, sneaking in as an ion pair, or even getting swallowed by a cell. So don't forget to like, comment and share this video with your classmates, and if you're new to our channel, make sure you subscribe it.